6.2 million U.S. adults have heart failure. Almost 400,000 people died from it in 2018. This translates to approximately 1 in 8 deaths. People don't often mistake heart failure as the organ failing to work. In reality, it's when your heart can't pump blood properly. Let's talk about 11 signs of heart failure you should never ignore. 11. Coughing. An accumulation of fluid in the lungs due to increased pressure on the heart stems from heart failure. This buildup of fluid can cause coughing, which may be sudden and intense. The coughing may result in the production of white mucus, but if the mucus is a pink-type color, it could indicate the presence of blood, which requires medical attention. Additionally, coughing that worsens at night while lying down may be a sign of pulmonary edema, a condition in which there is excessive fluid in the lungs. 10. Shortness of breath. On top of excess fluid in the chest, a person can feel shortness of breath with heart failure. This can be made worse if your lungs have developed edema. Lying flat can be particularly challenging for individuals with heart failure, resulting in wheezing and heavy breathing that can interfere with sleep. One effective solution is to use 2 pillows to elevate the upper body, which can help alleviate these symptoms. The buildup of fluid in the lungs can contribute to these breathing difficulties, but heart failure can also cause blood to back up in the pulmonary veins, which return blood from the lungs to the heart. The weakened heart is unable to keep up with the blood supply, leading to leakage of fluid into the lungs. Looking for answers on all the latest health and wellness news? Hit that subscribe button, and join our millions of followers. 9. Swelling of the lower regions. Edema, or the sudden swelling of the feet, legs, and abdomen can be a concerning symptom of heart failure. This swelling is caused by excessive fluid building up in your tissues. The bloating can be especially noticeable in the feet, making it difficult to wear shoes. In addition to swelling in the lower body, the abdomen may also become enlarged, leading to a bloated appearance. Meanwhile, fluid buildup in the lungs can cause breathing difficulties, as mentioned earlier. 8. Heart palpitations. Heart palpitations refer to the sensation of rapid, fluttering, or pounding heartbeats, which can be uncomfortable. These palpitations can occur both frequently and infrequently and usually start when your heart's upper chambers contract prematurely. When this happens, your heart is thrown off its rhythm. There are several causes of heart palpitations, like low blood sugar, dehydration, and low potassium, and excessive caffeine intake. Those with underlying heart conditions, such as heart failure, are more likely to experience heart palpitations. Number 7. Dizziness and fatigue. Dizziness and fatigue are common symptoms that can be caused by various factors, including heart failure. Those experiencing heart failure may experience dizziness and lightheadedness when standing up due to a drop in blood pressure. This is known as orthostatic hypertension and can be a sign that the heart is not functioning properly. Fatigue is also a common symptom in people with heart failure. When the heart is weakened and unable to pump blood effectively, the body may redirect blood flow away from the limbs and towards vital organs, such as the heart and brain. This can leave a person feeling exhausted and unable to perform even simple tasks. 6. Weight gain. A sudden increase in weight can have several possible causes, including fluid retention, inflammation, and dietary changes. People with heart failure are more likely to experience weight fluctuations due to a buildup in the body. If you experience sudden weight gain accompanied by hypertension or high blood pressure, it may be a sign of impending heart failure. People with underlying heart conditions may notice a 2 to 3 pound weight gain in the span of just 24 hours and may have gained more than 5 pounds by the end of the week. 5. Loss of appetite. Heart failure can make you not want to eat. Loss of appetite happens when the digestive system receives less blood. This can lead to unintended weight loss as the body is not receiving enough calories and nutrients. However, the sensation of feeling full may persist and one may also experience bloating or nausea. If this loss of appetite persists, it can result in the loss of both weight and muscle mass. Unintentional weight loss due to lack of appetite should be cause for concern, as it may indicate an underlying health issue such as heart failure. 4. Frequent urination. Increased frequency of urination, especially at night, can be a sign of heart failure that should not be ignored. When the heart is weak, it may pump less blood to the kidneys, causing fluid retention in the body. This can lead to reduced urine output during the day. But as the body becomes horizontal during sleep, the fluid begins to shift towards the kidneys, leading to increased urine output at night. Occurs because the kidneys are not getting enough blood due to the heart's inability to pump enough blood to all the body's organs, including the kidneys. 3. Sweating. This sign goes hand in hand with the previous sign. Sweating can signify heart failure due to the complex interplay between the heart, kidneys, and nervous system. It is a way for the body to eliminate excess fluid retention, mainly when there is an increase in the amount of fluid in the body. This happens through a process called osmosis. The body fluids move from areas of high concentration to areas of low concentration. Sweating mainly helps to maintain a balance. However, excessive sweating can also be a sign of other conditions, such as infection or hormonal imbalances. 2. Throat and jaw pain. Jaw pain during heart failure may occur due to referred pain. This kind of pain originates from one part of the body but is felt in another part of the body. This should not be confused with tooth pain. Toothache is a pulsating and sharp pain, while pain from the heart is a burning and oppressive feeling. Studies have shown toothache to be more intense than pain from the heart. Pain from the heart in the head and face is usually felt on both sides, while toothache is only felt on one side. The throat and jaw are the most common places to feel pain from heart failure. Pain in the head and face due to cardiac reasons are rare, but it can happen to 1 in 15 people. It usually occurs spontaneously and can be triggered by physical exercise. It does not change with movement or hot and cold oral stimuli and can be relieved with proper treatment for heart problems. 1. Confusion. Mental stress resulting in difficulties with balance, disorientation, and memory loss can all come from heart failure. These symptoms may be due to an imbalance of electrolytes in the body. Caused by heart failure. Leading to sodium retention, the fluctuating sodium levels in the bloodstream can strain the brain and limit adequate circulation, resulting in confusion. The heart is one of the most vital organs and we need to protect it. Have you ever dealt with any heart issues? Let us know in the comments below.